Hello, everyone, and welcome to RevMD Sex Bites podcast with me, your host, Dr. Deborah Durst, and my co-host, Faraday. Do you want to say hello?
Hey guys, Faraday Golombiewski. I'm the nurse practitioner here at RevitalyzeMD, and today we're going to talk more about erectile dysfunction and how we score it and how you know you have it.
So, do you know if you have erectile dysfunction? So, this is a scoring system we do in the office that you would be able to use potentially at home to even recognize the problem and maybe the severity prior to getting into the office. So, and it's called a Shim Score.
Yeah. Which is our sexual health inventory for men. It was derived from a longer questionnaire with more questions that was a little bit more in depth, the International Index of Erectile Function. But that was not easy to use in office. It's a little bit more
IIEF, like if you're looking at it.
The IIEF. So a very smart person took that and minimized it and made an IIEF 5 or a Shim, which is very reliable. And Shim has now been translated in 30 languages, is widely used, has high correlations.
Self-administered,
easy to use in an office to get a good understanding of where your sexual function is, and widely used. So it is a great scoring system that has great reliability, which is important. And is widely accepted. So it is not something we made up. It is not something that we came up with on our own. It is something that has been tested and shows correlation
in over I think 50 studies now with erectile dysfunction. Started with PDE5 inhibitors, sildenafil studies, and then they did this 5 questionnaire, abbreviated IIEF or Shim questionnaire, which is 5 different questions. We'll talk about that, but it started off with the PD5 studies and then went on to be the endpoint, or the gold standard basically for ED studies as well. And so now about 50 studies that show validation of this scoring system. So,
and when she's talking about PD5 inhibitors, she's talking about Viagra, Cialis, or
the little blue pill,
Tadalafil, if we're doing generic.
So the little blue pill, those were the first studies, but a lot of erectile dysfunction studies. So let's talk about what is the Shim score. So it's 5 different questions. So each question you're going to answer, and it's a score between 1 and 5. So the lowest score you can have is 5 and the highest score you can have is 25.
It is something that we actually included it in the show notes so that you can look and see where you score and see what that question is and be honest with yourself and get a good idea of where you're at. So really, when you think about that on a 5 to 25, anything less than a 21 shows some signs of erectile dysfunction, which is really interesting when you think about it. It doesn't take much to show difference. And then further from there, I think that we went ahead and even designated from there mild versus moderate and severe.
It'll break it down for you, score of 22 to 25. So again, 25 being the highest, you really don't have any issues at all with function. And again, some guys will come into the office younger with no functional problem. Well, I mean, I guess kind of a functional problem if it's a sensitivity or premature ejaculation or, a decreased sensitivity and having trouble ejaculating. That's it's on the spectrum, but that would be no function with getting erections. And so that would be a score from 22 to 25 and then 17 to 21 being mild. And then 12 to 16, mild to moderate, 8 to 11, moderate and then severe, 5 to 7. So again, if you're on the lower end, 5 to 7, 15 is the perfect score. That's what you want to be, or 25 is the high end. So there's a lot of functional improvement to be gained. And so that's why we use that scoring system, because it can tell us how severe and how to approach it. So.
Absolutely. Which best treatment model would work for you? So for us, we use it as a treatment tool. But it, again, is good for you guys out there to self-test yourselves. You may be a 25 today and in 2 years revisit and be an 18 and go, oh, what happened?
And really when you start to, and you want to use the last 6 months of time.
Yeah.
So you're evaluating the last 6 months. And again, if you're using like the little blue pill, or you're using Cialis or Viagra or generics of those, you also want to know what that score is without those. in the score with those, because ideally you want to try and get a score that is in that normal range without any kind of assistance. So
the only time we see this scoring not as easy to decipher is for guys that have no function, because it's hard to answer those questions. You're going to have a 5, right? So you can't answer if you're satisfied, right? So if you're not being sexually active, it doesn't really apply because you're going to answer none on everything. Or those that are not actively engaged in sex, it's hard to answer these questions if you are not sexually active and have not been sexually active. So for those guys out there that are not currently active, or maybe have such low function that they're just not bothering to engage in sexual activity, these questions are going to be a little bit harder to answer, and we're going to see a 5.
Yeah, correct. And so what are some of the questions? And because it is a multi-dimensional, just with the 5. So again, it was a longer scoring system. These apply to areas that will give us information on, the psychology there, what you're thinking, and how your function is. And so the first question, which I think is key, because a lot of times if you're starting to notice any differences at all, like where there's one time with alcohol that your function wasn't perfect, or wasn't your usual, then you're going to start to question. So that confidence level is the first question. Yeah. So how do you rate your confidence that you could get and keep an erection? So that's the first question. So
absolutely, because we do get in our head, men and women. So as men, I feel like we see that a little bit more than with women. With women, we overthink everything. So we definitely can be in our heads too. But with men, you don't perform great once or twice. Then it becomes a worry. Is this going to happen again? And then you're less likely to perform that next time if you're constantly thinking about what if. So we see lots of guys that take the little blue pill, right? Viagra, Cialis, anything like that, because they're worried to not take it because maybe one night they had a little too much alcohol with dinner and they didn't perform, and now they're scared that might happen. So they just medicate to make sure it doesn't happen. So confidence is huge.
I think that's absolutely huge with men, especially when it comes to erectile function and erections, because if you have it happen once, even if it is you're young, you're healthy, you don't have medical problems, you're not on medications, but you have too much alcohol and it really is alcohol related, then once you start to question that, the confidence, if it goes down at all, will definitely affect potentially those future performances. So
absolutely.
So I do find that I think women can be in their head about a lot of things, but this is a pretty objective thing for both men and women. And so it definitely plays a role for men. They get in their head with this for sure.
Exactly. And you guys can't hide it. At least we can hide it.
Yeah, we can hide it, but men can't hide it. Right? Everybody in the room knows.
Exactly.
So that's a given. So the second one is, again, when then you have some sexual stimulation, which is what Faraday is saying. So now you have sexual stimulation. And then how often are you able to get an erection hard enough for penetration? So that's the second question. And those scores with each question is 1 to 5. 1 being never or almost never.
Yeah.
And 5 being, almost always. So, or always.
I'm extremely confident. I got this. I'm going to knock it out of the park every time, right?
Every time. So then that's a 5.
It's a 5.
Yeah, it's a 5. But if you're doubting, so again, just be very honest, because the only way to get improvement with this, and when we tell our patients this all the time, we want you to be open and honest, because we want you to get the improvement that you want with any kind of treatments. And again, everything is so variable what you do, and it's individualized, that we need to know your specifics, and that includes medical histories too. And we'll go into that.
That way we also know the extent to which we need to treat. Because if we are, a 21 and we have some evidence of erectile dysfunction, but when we look at your scoring, the reason you're a 21 is because you don't have confidence, but everything else you're okay with, we probably don't need to start on the most aggressive treatment, right? Because we're not having some of those functional issues. It's a confidence issue, and there are some things we can do in place to help build that confidence that we can later take away.
It's multidimensional, so it gives us a lot of information, a lot of feedback. So the third question then, so during sexual intercourse, how often are you able to maintain your erection for penetration? And so that would be, you can get the erection and penetrate. And so Again, score of 1 to 5.
Yep.
And then fourth question is, how often are you able to maintain that erection for completion in orgasm? And so that actually just takes you the step further. And then the fifth question is, how often that you've attempted sexual intercourse is it actually satisfactory to you? And that kind of encompasses everything.
Everything. So that doesn't necessarily mean till the end, right?
Yes.
Is it satisfactory to you? I've learned through this environment that can mean a lot of different things to a lot of different people. So when we talk about your Shim scoring in office, we ask, okay, well, what does satisfactory mean to you? Is it just, some guys are like, man, I got in there. That's satisfactory, but is that really, were you able to complete? Were we having an orgasm? Did you have an orgasm that lasted, that was strength wise? Was it weak? Was it strong? Satisfactory can mean a lot of different things. So definitely important when you're in the office, when we talk about that, of what that means to you, so that we also, again, know how to treat.
Well, and again, if you're using a little blue pill to assist you and your confidence isn't there, so your satisfaction is not always there, because it's not always there because you're worried. And if you're concerned during sexual intercourse and you're using something to assist, then definitely you want to score that satisfactory question the right way. So
exactly.
And so that allows us to get a baseline of, 5 to 25. And then we also discuss it with the patient so that we know exactly what they're thinking when they scored this way. So it's not just like we're looking at the number. We want to make sure they understand the question, that there might, be some other details they want to add in, because this will give you a basic score, but this is a starting point for a conversation. Absolutely. And it gives us an objective number as a baseline.
And I think it's really important as well for us to know if you scored that with the thought of, these are my scores when I take Viagra or Cialis. So that is really important too, because sometimes we'll see a very low score and they're like, oh, well, that's with nothing. When I have something, I'm here. Or we'll get a really high score and they're like, yeah, well, I take a little blue pill every day. And so we're not seeing true functionality there. So even that distinction of, like Dr. Durst was saying, we're looking at the last 6 months and then defining, okay, is this with medication, without medication, with extra stimulation, without, really where we are.
Yeah. And did we escalate our dose of the medication, and now we're noticing a decreased function? So, not only what the score has been, how it's changed over time, and what interventions you've used to change that over time. So there's lots of things that go into the conversation in the office to determine where you are, and then also, what we need to do to get you the results that you want. Which, again, so we talk about multiple different and a very comprehensive approach that includes, Gaines wave, and which is the acoustic shock wave therapy. That's an in-office procedure that's used to increase blood flow. And we have lots of different podcasts that go into, Gaines wave more specifically.
And the P shot. So that we have a ton of podcasts on that as well. Hormone optimization, peptides like PT141. So we have lots of podcasts out there to further deep dive into some of these treatments if you guys are interested in.
Yeah. And then you can do even some IV therapy that also includes amino acids that are helpful for sexual function. Again, we have some assistance. So when we're doing treatments and regenerative treatments, we can also do some things that you can use at home during that regenerative process, so that it helps you get function prior to completion of the treatment process. And again, it's all individualized. So those conversations are best had in the office with an office that actually does a comprehensive approach to sexual functional changes or sexual dysfunction, so that we can get you exactly the function you want in the bedroom.
As you guys hear us say often, it is not a one-size-fits-all treatment.
No.
There's definitely multifaceted. So some people just need one thing, or maybe two. Some we need 5 or 6 things, or maybe we go a completely different route and try something that maybe you did not even realize was an option when you came in the doors.
And a lot of times you just don't have a lot of places to have those conversations. And so we want patients to be open to have any conversation, anything that's bothering them. Because if you're not going to have it here, where are you going to have it, for frequently, because some people will not have those conversations openly at home or in their primary care doctor's
or
office.
with their partners
or with their friends, so
we know guys don't talk with their friends. We've had that conversation.
Yeah. We have podcasts on that too. Again, men aren't talking to friends. Women are a little more open to that, but men definitely are not having a beer and talking about erections, especially if there's any issue with erections.
Exactly right.
Definitely no one knows that.
Yeah, man, I'm great.
Yeah, I'm great. I have too much sex. Yeah. So
all the time, every day.
Yeah. So definitely this is a place and a safe environment for you to have those conversations. So again, let us know your comments, any questions you might have. In the show notes, the scoring system is there so you can take a look at it. And any experiences you have that you want to share, we're open to that. And then likewise, hit the bell, subscribe, share with friends.
See where you measure up.
Yeah, that's right. Absolutely. And then again, let us know what you want to talk about or cover in the future. We're willing to deep dive into anything sexual wellness, and we're here to revitalize your look, your health, and your sex life. Thank you.